Dr Karina Severin from the Jean Hales Clinics, you have a special interest in sexual health, so I'm really excited to have you here to be part of our Healthy Aging podcast series.
Me too. I love talking about sex.
There's a good start. Now, good sexual health is about being able to enjoy a regular and satisfying sex life, whether that's by yourself or with someone else. So tell me, why is it important to have good sexual health?
Well, sexual health is part of what makes us human, or sexual function is what makes us human. And we, are one of those few species that do have sex for fun and not just for reproductive purposes. So it's really part of our being. But, what makes healthy sex life or a satisfying sex life, can mean different things for different people. And that doesn't have to mean reproduction. That could be intimacy or connection or pleasure and fun. All of these things are part of it. And so that, as you say, could be with another person, or it absolutely could be by yourself.
And it does change, as you say, over the life course. At one point, it's going to be about that reproduction, perhaps, and other times it'll mean different things to you entirely.
Definitely. And I think it would also depend a bit on, what's your relationship status? Are you someone who is meeting new people? Are you someone who is trying for pregnancy? Are you someone who's been with the same partner for a long time, but actually your sexual life is part of, what keeps you together, or part of what makes it special for you as a couple in your relationship? So it doesn't have to be the same thing between people, and it doesn't have to be the same thing at every point of your life as well. It's going to look different depending on where you're at.
So is it normal for sex drive to go up and down throughout our life course?
It is absolutely normal for sex drive to go up and down. It is heavily influenced by things that are happening both on a physical level or hormonal level, and also, from a stage of life.
All those stresses.
Stresses, children, jobs, menopause, you name it. All of these things can have an impact on people's sexual life. Some people have a real spontaneous type of libido and sexual desire. This is the kind that you see in like a movie where you're in the throes of excitement and you see the person, and next thing you know, you're just
So I'm tipping this is something that happens more with new partners, perhaps a little harder with people who've been around a while.
Exactly it. So I was going to say that the thing about this is often the type of typical type of desire that's presented in our,
in movies but not
and
real life.
But it's not often the way that this really turns out in real life, and and if you're the sort of person that has that kind of spontaneous sexual desire, well, that all power to you, and I think that's amazing.
But you shouldn't expect it, perhaps.
But I think if that's not the way that you tick, and particularly as you get older, please don't feel bad about that, because this is very normal for it to not quite work that way in real life. I think what's a more common type of desire is what they call like a responsive desire. And that's the kind where you might not be thinking about it, it's not really on your mind, but you know that if you set the scene and you get the ball rolling, that as things go along, you'll probably enjoy it and you'll have a good time and you'll get there in the end. And this is also really normal.
And is that a bit about being receptive and responsive to someone else's overtures?
Exactly. So sometimes that's a case of, so we see this a lot when I'm speaking to, women in the clinic, and that they sort of say, well, I'm not really thinking about it, but actually once we get going, it's actually pretty fun and I have a good time. And, but I think sometimes there's this perception that that's not the right kind, because that's not your typical movie moment kind of desire, but is really normal, it's healthy, and it's completely fine if that's the way that you tick.
Right. And although we're Jean Hales for women's health, we do hear that about the men as well. They don't always have the same sex drive.
Absolutely right. That, and I think one of the things that can happen to, particularly if you're in a long-term partnership, that what can happen over time is that people's level of sexual desire or their type of sexual desire doesn't match the other partners. And I think that, a lot of the time when I'm speaking to people who are having issues around sex, at any point in their life, it doesn't have to be older people, it's often actually that they in themselves feel fine, but the issue is that it doesn't match their partners. And how do you negotiate that space together? And this is particularly something that people can struggle with if one person has a very high level, they have that spontaneous desire and they want the other person to have it that way, and that's not quite the way that they
Right.
tick. So how do you negotiate that
So it
space?
sounds like communication around those needs, those desires, those concerns is really important.
It is really important, and I think that not only is it important, but also acknowledging that we're all different,
Mm.
and you're still normal. You're still normal. I think there are some people that find though that they do get to this point in time where, look, they're really not interested at all, and that's even even if the scene is set and the conditions are right, they still not can't get into it. And this is also really common as people get older for this to happen. And this can be for all sorts of
Mm.
reasons. And this might be the sort of thing that where you really have to nut out as an individual, or perhaps with your GP or someone to help you, or a sexual therapist perhaps, to kind of get to the bottom of why that might be, if you really feel like there's nothing. And some sexual therapists talk about the difference between accelerators and brakes. So there are some things that accelerate libido and desire, things that make you actively interested, and then there are a whole lot of brakes, which are things that are putting you off.
Right.
And so sometimes it's a case for you as an individual to have a think about, well, what are the factors for you that are making this a zero interest zone? Is this because you've got a lot of life stresses? Is it because of relationship issues? Is it because of physical health? Is it because of other
So
illnesses?
it's understanding the individual circumstances and then
Exactly.
addressing them.
Exactly.
So going to one point that I know does affect women, particularly as we get older, let's talk about lubricant or lube. Tell us why it can be so handy in the bedroom.
Oh, absolutely. So I think, this is a really common thing that I see in the clinic, because when a woman, so we're talking about for lubricant for women particularly, but obviously for both partners in this situation. But what's really common for women after menopause is to really experience vaginal dryness.
Mm.
And this is a physiological thing that happens as your estrogen levels start to fall with age. The what estrogen does in the vagina is stimulate sort of collagen production and elasticity, stretch, and lubrication. And so what can happen over time, particularly the further you go post menopause, is that the vaginal walls lose some of their stretch, they lose some of their elasticity, they lose some of the lubrication, and it just becomes sore.
Right.
It just becomes sore. And and then if you go to have sex, it can
So
be
that's
really sore.
penetrative sex, but
If
even if it's non-penetrative sex,
Oh, yeah,
lube can still add to the experience.
absolutely. So, I think, it doesn't even have to be in sexual activity to be dry and sore.
Right.
So, this is a common thing. So I think one of the most basic things that couples can do is to use good lubricant. And for
What
that,
does good lubricant mean?
yeah, so I mean, there's all sorts of types, and you know, there are different types of lubricant for different purposes. So, your typical
That's new for me.
water-based,
I thought it was just there's
there's
one
one
and
and done.
done. No.
So the thing is that a lot of lubricant that's sold just like off the shelf at the supermarket, for example, is really designed for people to use with condoms. And
Right.
water-based lubricant, because that doesn't cause condoms to split or to break. But the water-based lubricant is not quite as good for actual lubrication because, it evaporates and it dries and sometimes leaves a sort of a sticky residue, which is not very nice. So if you are having penetrative sex or even, just foreplay contact and wanting to use a lubricant, but you're not needing to use condoms, we would recommend that people use a either an oil or a silicone-based lubricant because these tend to have more staying power and not evaporate and dry, and so they go the distance, so to speak.
And they're not irritating because we do have a lot of women come to the Gene Health clinics because of vulval irritation. These lubricants are fine for
Look,
non-irritation.
I think if you buy one that's from a reputable company that is designed for this, then they're good. But sometimes even just oils such as almond or olive can do the job as well.
Right, so raid the pantry if really in need.
Exactly, like as long as it's something that can be a bit more messy.
Right, that sounds like it might be very messy.
But you can work around that.
Oh, well, it might help with that spontaneous desire, right?
I think the other thing to say, is that if some people that's not enough, and some people do require, it is possible if according to your circumstances to speak to your GP about using some vaginal estrogen cream or other sort of there are some other prescription medications that can help if that's not enough. Right. And if that's something that you would like, please.
So let me come back to condoms because we actually do know that sexually transmitted infections are increasing pretty rapidly in older women. Now, why is this, and what's your advice for women who are perhaps re-entering the dating scene? Because I presume that's what it's about.
We're speaking to many people now who perhaps might have been in a very long-term relationship that's ended, and after a period of time, they're getting back and they might be starting to see new people again, which I, for one, think is amazing.
Oh, totally.
When you are in your reproductive years, there's an incentive to use condoms to prevent pregnancy. And one of the things that you're liberated from after menopause or after your reproductive years is that you don't have to worry about that anymore, particularly if you're with a new partner or a casual partner. And so there's less incentive to use condoms because you're not thinking about that as your driver or your motivation. I think the other thing is that sometimes people may have come from backgrounds or in the past where they've never really addressed or taught, STIs or sexual transmitted infections weren't something that we talked about. Right. People may not have had good sex ed or there might even be like a misconception about what STIs are common and how they present. The thing is that most sexually transmitted infections don't really have obvious symptoms. Right. And so there could be a misconception that because you can't see something or because the other person says that they're fine, that there's no risk there.
It's going back to those safe sex principles if you're starting with a new partner around using a condom, testing. And then when would a woman come in to see you if she had concerns about an STI? If you say there's not many symptoms, because I know we're seeing them in the clinic. Why are they coming?
For sure. So I think that for women in particular, a lot of STIs present with sort of vague symptoms that are not particularly obvious, and it might present as sort of itching or sores or perhaps a change in discharge or a change in smell, and that might be when we pick them up. I mean, the other thing is that people may not realize how easy it is to just do screening because if you are someone that doesn't have symptoms, which is the majority of people who, low majority of STIs, we don't even need to do an examination to do a test. So I really want to just stress that it is very easy, very non-invasive to either a self-collected swab or a simple urine test plus or minus some blood tests to do a full STI screen. And this is something that, say, for example, if you were going to be having some pathology taken anyway, you're having your cholesterol checked, you could mention to your GP, oh, I've seen
Got
your
a
new
new
partner
partner.
and I
Mhm.
would just like to be on the safe side. Can I do my sexual health screening? And please don't be embarrassed to bring this up, because I,
Yeah.
for one, would be like really, thrilled for you that this is the situation that you're in, and the fact that you were thinking about your health.
Right, right.
It's so easy.
And do you think that there are some women who are a little bit reluctant to talk about their sexual health with their GPs? I mean, you have an interest in sexual health, so you're perhaps not the ordinary everyday
True.
GP, but generally, GPs it's just part of the job, right?
It is very much part of the job. And I think it can be difficult if, say, it's your same GP who you've seen for the past 40 years and they
Mm.
feel like a family friend, maybe that might not be
Well, or if you're in
comfortable.
a small country town or a regional area as well, you
Absolutely.
may not want to talk about being in a new relationship. So,
Abs-
is there anywhere that women who are faced with that, I hope my mother doesn't mind, but she often talked about, she played tennis with her GP, so she
Yeah.
didn't want to disclose everything to her tennis
Look,
partner. What's your advice?
look, there are up and coming more sort of sexual health clinics that are in communities where even nurse run clinics where, because
Right,
if you don't have symptoms, you could bring it up when you're having a cervical screening. You could sometimes do it that way. So there are uh, other clinics that you can go to, or even telehealth potentially.
right,
There
okay.
are some telehealth services that can do STI screening. Like it's just,
Or at least let you know where to go.
or at least let you know where to go. Exactly. It
Mm.
could point you in the right direction, or could help you to sort of find a place locally that you could do the screening.
Fantastic. That's really helpful. Thank you. So, let's sum up by asking you, what are the 3 things you want older women to know about sex?
Firstly, I would just like to tell people that you're normal. Whatever it is, the way that you feel is on the spectrum of normal.
There's no
Okay.
such thing as
There
normal,
is
it's
no such
just
thing as
all
normal.
okay.
It's all okay. If you are someone who has got, the sexual desire like in the movies, that's amazing. If you're someone who's a bit slow to warm up and you just need to kind of, everything needs to be right, but you'll get there in the end, that's normal.
That's
If
totally
you're someone
fine.
who could kind of, a lot of couples at this, or a lot of, not even couples, but a lot of people at this point, they find, if you think back to the question of why do people have a sexual life, sometimes people at this stage of life get those things from other aspects. So, you might get your intimacy just from connection with your partner. You might get physical activity by doing yoga and Pilates. You might have other ways to fulfill those needs, and maybe you don't need this anymore. And that's also
Right,
normal. It's
right.
also normal. So, don't feel like judged if you're not the way that somebody else is.
Or that you think you should be. Okay, so
Yeah.
number 1 is definitely there is no such thing as normal. Whatever is right for you is just right. Okay, what about number 2?
It can be really difficult at this point in time to negotiate with a partner if you are not on the same page about what you want.
Right.
This can be really tricky, and the key really is finding a compromise. Like, what is it that you want from this, and how can you achieve that in a way that's not telling the high libido person that they can't have sex anymore, and if it's but on the other hand, it's not forcing someone who doesn't
Yeah, I mean,
want
no
to
one should
either.
feel pressured, right?
This is the thing, is that, like, unfortunately, we know that there are some people who do still get pressured into this, and it doesn't matter if you've known someone for 30 minutes or 30 years, like, that doesn't make that okay,
Yeah.
and, but it can be very difficult to kind of negotiate that. I think that something that can be really tricky for people who've kind of always done things the same way for a long time, that when things change, sometimes you have to redefine what sex means
Right.
for you, and it doesn't have to involve penetration,
Sure.
particularly if that's painful. Or, for example, even for men, sometimes they start to have issues with erectile dysfunction, or, unable to orgasm. And sometimes for men that can be really crushing because that's sort of way that sex is defined. But that's up to you as a couple, or or as an individual, to sort of to find another way, be creative, and explore the way that you want to manage this. So, do things differently and try things out. And you're never too old to try something new and different. So that would be my next thing.
Okay.
But I think that if you are someone who is, but it's not okay to be forced, is the other thing.
Right,
I
of
think that
course.
there's a fine line between kind of negotiating
Sometimes a little
and giving it, exactly. I'll give
compromise.
in to you, I'll do this for
Yeah,
you if you do this for me. But, it's never okay to be forced if that's not what you want.
sure. So number 3 out of your top tips.
So the next thing is that, bodies get older and they change.
I
And
have noticed this, Karina, myself.
they do. So things are going to change. And, sometimes you do need to start to work around other physical complaints or issues that can arise as people get older. And I think this also does come back to a bit of creativity and exploration.
So are we talking about a dodgy back here, or are we talking about our body image?
Both, I would
Right.
say. So sometimes, for example, you're right, you've got your hips, you've had a hip replacement, and, you can't put the leg in the same position that you used to be able to do. So, sometimes people have to get creative with like pillows or aids, and there are all sorts of things you can experiment with to play around with to get that right. So sometimes that might be a case of looking at a lot of medications can have an effect on people's libido or their sexual drive, and if, for example, antidepressants and some cardiovascular medications and things, diabetes, all of these things can have an effect on people's sexual function. And I think that please don't be scared to bring this up with your doctor if you feel that this is a thing, because there are often other options, or they might be, if you don't bring it up, then we don't know.
If there's someone who is having problems with their sexual function, problems that are worrying her, what could she do about it?
So if you come and speak to your GP, or if not your GP, if you're not comfortable with someone like us,
Us being Jean Hales, or a specialist women's health clinic.
A GP or a doctor with a special interest in women's health or sexual health. So that could be a sexual health clinic, it could be a reproductive hub, it could be a GP, depending on where you are. We would delve a little bit deeper, I guess, into what your particular issues are and if there's something we can do about it. And that could encompass all sorts of things, from your over-the-counter lubricants, moisturizers, and there are all sorts of interesting things coming out that are quite useful to know about. Or, is this something where we need to do an examination to make sure that there's not an underlying medical issue? Because, for example, some women can develop skin conditions of the vulva that they might not realize could be treated. Or it could be a simple issue of providing some local estrogen replacement to kind of rejuvenate the tissues a little bit, which for most people is quite safe to use at any age.
That's the vaginal estrogen.
That's your vaginal estrogen, which is different to your more generalized hormone, menopause hormone therapy, like that someone might be using.
Gels, exactly. That's different, right?
Exactly. Okay. So it's different to that, and I sometimes liken it to the difference between like taking a steroid tablet but using a steroid cream.
Right.
Although they're the same thing, they're not the same thing.
The method of delivery is very different. Yeah.
Exactly. So some people have a really good response to that. If this is an issue more around libido and desire. Sometimes we might look into see are there things that medications that you're on that might be affecting that, and can they be changed? And for some women, there may be a role of something like testosterone, but obviously that is individualized, and probably you would need to speak to sexual health doctor or GP about that.
Now, let me come to that body image question again.
And this is very hard.
Because, we see so many really unrealistic portrayals. You've touched on sex, it's supposed to be spontaneous and you're ripping your clothes off and, it happens at the drop of a hat. But at the same time, we also have these visions of what we looked like when we were 19 versus what we look like when we're 69. How do you do you see women who are really that's the break, that's the barrier to enjoying sex is just they're not in the same place that they used to be?
Unfortunately, yes. I do
Right.
see people who say this, and it sort of makes you really, disappointed in a way. Like, I think it's great to be getting older and wiser and changing, but you can't expect that your body's going to be the same. I think as it was when you were 20 or 30 or 40, like things are going to change, and they're going to be in different places that they weren't before. Weight gain is extremely common.
Right, sure.
Almost everybody is gaining weight with age. It's just a part of the world that we live in. And the thing is that, chances are your partner is too.
Yeah, we never talk enough about the dad bod, do we?
Exactly.
It's always the pressure on the woman.
And if you really think about it, they're doing this to be with you, and
self-love might not just be physical when we're talking about a good, healthy sex life. It might also be about how we view ourselves.
Absolutely. Absolutely. And you think, this person wants to be with you for who you are, and it's not about looking like you're on the cover of a magazine. Like, who cares about that? That's not normal life, this is normal life,
Right.
It's something that you enjoy spending time with, and you got to let that go.
I think that's a very wise words to finish on. Dr. Karina Severin, thank you so much for being part of our Healthy Aging podcast series.
Pleasure.